What if your body has been trying to warn you for weeks, but you've been ignoring every signal? Most people don't realize that serious health problems often begin quietly. Long before a diagnosis, your body may send subtle warning signs through your skin, your feet, your nails, your energy levels, or even your sleep. The problem is that millions of people dismiss these symptoms as just getting older. In today's video, you'll discover 9 silent warning signs that could reveal hidden health problems before they become much more serious. And knowing them early could give you the chance to take action before small concerns become much bigger ones. Your body is constantly communicating with you. It doesn't send text messages, it doesn't make appointments. Instead, it whispers a change in your energy, a strange sensation in your feet, a mark on your skin that wasn't there before, a restless night that turns into weeks of poor sleep. These signals are easy to overlook because they rarely appear all at once. They often develop gradually, blending into everyday life until they begin affecting your health in ways that are much harder to ignore. After the age of 50, paying attention to these changes becomes even more important. While many physical changes are a normal part of aging, persistent or unusual symptoms should never be dismissed simply because of your age. Sometimes they're harmless. Other times they're your body's early request for attention. The encouraging news is that recognizing a warning sign doesn't automatically mean something serious is wrong. In many cases, it simply means it's time to understand what's happening and, when appropriate, speak with a qualified healthcare professional. Early awareness can often lead to earlier evaluation, more treatment options, and better long-term outcomes. So let's begin with the first silent warning sign, one that many people experience, yet surprisingly few take seriously. Warning sign #1. Constant fatigue that doesn't go away. Everyone feels tired from time to time. Maybe you stayed up too late. Maybe you've had a stressful week. Maybe you've been more physically active than usual. That's normal. But persistent fatigue is different. This is the kind of exhaustion that lingers even after a full night's sleep. You wake up feeling as though your batteries were never recharged. Simple daily activities begin requiring more effort than they used to. Walking through the grocery store feels unusually difficult. Household chores seem overwhelming. Even activities you once enjoyed start feeling like obligations. Many people over 50 quietly accept this change. I guess this is what getting older feels like. But persistent fatigue should never be automatically blamed on age alone. Your body requires energy to keep every organ functioning properly. When that energy suddenly changes, it's often worth asking why. Ongoing fatigue can have many possible causes. Poor sleep quality, anemia, thyroid disorders, nutritional deficiencies, depression, medication side effects, diabetes, heart disease, chronic infections, and many other conditions may all contribute. That's why one symptom should never be used to diagnose yourself, but it also shouldn't be ignored. Notice when the fatigue began. Has it gradually worsened? Does it interfere with daily activities? Do you feel short of breath doing things that once felt easy? Are you sleeping but never feeling refreshed? These details are valuable information to share with your healthcare provider. Remember, fatigue itself isn't the diagnosis. It's a message. And sometimes listening to that message early can make an important difference. Now let's move to another warning sign that's literally impossible to miss. Yet many people still overlook its importance. Warning sign #2. Swelling in your feet or ankles. At first it may seem minor. Your shoes feel tighter by the evening. Your socks leave deep marks around your ankles. One foot looks puffier than the other. You assume it's because you've been standing more than usual. Sometimes that's true. Long periods of standing or sitting, warm weather, or certain medications can all contribute to temporary swelling. But when swelling becomes frequent, persistent, or progressively worse, your body may be asking for closer attention. Fluid doesn't accumulate without a reason. Sometimes the explanation is relatively simple. Other times, swelling may be associated with problems involving circulation, the veins, the kidneys, the liver, or the heart. The swelling itself doesn't identify the cause, but it tells you that something deserves evaluation. Pay attention to timing. Does the swelling improve overnight? Is it present every single day? Is only one leg affected? Do you also notice shortness of breath, chest discomfort, or sudden weight gain? Those additional symptoms provide important clues and, in some situations, may require prompt medical assessment. Your feet support you every day. Perhaps it's time we start paying closer attention to what they're trying to tell us. Speaking of feet, there's another silent warning sign that often begins there before spreading elsewhere. Many people describe it as a strange tingling sensation. Others compare it to tiny electric shocks. Some say it feels like they're walking on cotton even when they're barefoot. And that's exactly where our third warning sign begins. Warning sign #3, numbness, tingling, or burning in your hands and feet. At first, the sensation may come and go. You notice it while watching television in the evening. Perhaps your feet begin to burn after you've been lying in bed for a while. Maybe your fingertips don't seem quite as sensitive when buttoning a shirt or holding a coffee mug. Because the symptoms are mild, it's easy to ignore them. Weeks pass. Then months. Eventually, what was once an occasional tingling sensation becomes something you notice almost every day. Your nervous system acts like a vast communication network, carrying messages between your brain and every part of your body. When those signals become disrupted, numbness, tingling, burning, or unusual sensations may appear. There are many possible reasons this can happen. Diabetes is one of the more common causes of nerve damage, especially when blood sugar has remained elevated over time. But diabetes is far from the only explanation. Vitamin B12 deficiency, certain medications, nerve compression, poor circulation, autoimmune disorders, excessive alcohol use, and several neurological conditions can also affect the nerves. That's why it's important not to guess. Instead, pay attention to patterns. Do the symptoms occur only at night? Are they getting worse? Have they started affecting your balance? Do you feel less stable while walking? Loss of sensation isn't simply uncomfortable. It may increase the risk of trips, falls, burns, or unnoticed injuries because your body isn't receiving normal sensory information. If you've ever stepped on something sharp without realizing it immediately, or found a small wound on your foot that you don't remember getting, that's something worth discussing with your healthcare provider. De set is vu et fard or feini fried e relay verfares produce sa afraor. Ici as prav cure fordse. It prive care war healthcare provider. Immediately hortse immediately refu a ifrav. The earlier nerve-related problems are evaluated, the greater the opportunity to identify what's causing them and determine the most appropriate treatment plan. Now let's look somewhere many people rarely examine carefully, even though it can reveal surprising clues about what's happening inside the body. Warning sign #4. Changes in your nails, your fingernails and toenails do much more than protect your fingertips. They grow slowly over time, reflecting changes that may have been developing inside your body for weeks or even months. Healthy nails naturally change somewhat with age. They may become more brittle or grow more slowly, but certain changes deserve closer attention. Notice if your nails suddenly become unusually pale, if they develop dark streaks that weren't there before, if they become thick, severely misshapen, or begin separating from the nail bed. Some people notice spoon-shaped nails that curve upward. Others develop nails that become unusually rounded or enlarged at the fingertips. These changes don't automatically point to one specific condition. Instead, they may sometimes be associated with nutritional deficiencies, circulation problems, lung disease, thyroid disorders, infections, skin conditions, or other underlying medical issues. The important lesson is simple. Don't ignore noticeable changes just because they're painless. Pain isn't the only sign that something deserves attention. In fact, many health conditions begin quietly, without causing any discomfort at all. The next time you're trimming your nails, take a moment to actually look at them. You're not searching for reasons to worry. You're simply becoming familiar with what's normal for your own body. Awareness can make genuine changes easier to recognize. Speaking of visible changes, your skin often provides even more information than your nails. And that's where the fifth warning sign appears. Warning sign #5. Skin changes that don't go away. Your skin is your body's largest organ. It's constantly responding to both your environment and your internal health. Some changes are completely expected as you age. The skin becomes thinner. It loses some elasticity. Dryness becomes more common. Bruises may appear more easily than they once did. These are typical age-related changes. However, certain skin changes deserve prompt attention. A sore that refuses to heal. A mole that changes in size, color, shape, or begins bleeding. A new dark spot that grows rapidly. yellowing of the skin or the whites of the eyes, persistent itching without an obvious cause, a rash that continues spreading despite basic care, or skin that suddenly becomes unusually pale or bluish. Each of these signs can have many possible explanations. Some are minor, others may indicate conditions involving the liver, circulation, autoimmune disorders, infections, nutritional deficiencies, or skin cancer. That's why observing changes is far more valuable than trying to diagnose yourself online. Your skin often tells a story before other symptoms appear. Learning to notice those chapters early may help you seek medical advice before a condition progresses. Now let's move from what you can see to something you experience every single day, but many people underestimate its importance. Warning sign #6. Sleep that suddenly changes. Almost everyone experiences an occasional restless night. Perhaps you're worried about something. Maybe you've had too much caffeine. Maybe the room was too warm. One bad night isn't usually a cause for concern. But persistent changes in sleep deserve attention. Are you waking up repeatedly every night? Do you struggle to fall asleep even though you feel exhausted? Do you wake up gasping for air? Has someone told you that you snore loudly or seem to stop breathing during sleep? Or perhaps you're sleeping much longer than usual yet never feel rested. Sleep is when your body carries out many essential maintenance processes. When sleep quality declines over weeks or months, you may notice changes in memory, mood, concentration, blood pressure, energy, and overall health. Persistent sleep problems can sometimes be linked to stress, anxiety, medications, chronic pain, sleep apnea, restless leg syndrome, hormonal changes, or other medical conditions. Rather than accepting poor sleep as just part of getting older, consider it another conversation your body may be trying to have with you. Because sometimes improving sleep begins with identifying a problem you didn't even realize was there. And the 7th warning sign may be one of the most overlooked of all. Not because it's uncommon, but because it develops so gradually that many people don't recognize it until it has already begun affecting their daily lives. Warning sign #7. Unexplained changes in weight or appetite. Have you noticed your clothes fitting differently even though you haven't intentionally changed your diet? Maybe you've lost weight without trying, or perhaps you've gained weight rapidly over a short period of time. Just as important, has your appetite changed? Do foods you once enjoyed no longer appeal to you? Do you feel full after only a few bites? Or are you constantly hungry despite eating regular meals? Our body weight naturally fluctuates from time to time, but significant unexplained changes deserve attention. Unintentional weight loss can sometimes be associated with digestive disorders, thyroid conditions, diabetes, infections, certain medications, depression, or other underlying illnesses. Unexpected weight gain may sometimes relate to fluid retention, hormonal changes, medication effects, reduced physical activity, or metabolic conditions. The number on the scale doesn't tell the whole story. It's the unexpected change that matters. One simple habit can make a real difference. Weigh yourself occasionally under similar conditions and pay attention to trends rather than daily fluctuations. If you notice a significant change that wasn't intentional, especially if it's accompanied by fatigue, pain, digestive symptoms, or other unusual changes, schedule an appointment with your healthcare provider. Sometimes your body begins changing long before you actually feel sick. Listening to those changes gives you the opportunity to act early. Now let's talk about a warning sign that many people assume is simply part of aging, but it often deserves much closer attention. Warning sign #8. Memory changes that interfere with daily life. Everyone forgets things. You walk into a room and forget why. You misplace your keys. You can't remember the name of an actor in a movie until hours later. Occasional forgetfulness happens at every age. But there's a difference between normal memory lapses and changes that begin affecting everyday functioning. For example, repeatedly asking the same questions, getting lost in familiar places, forgetting important appointments despite reminders, having increasing difficulty managing finances, medications, or familiar tasks, struggling to follow conversations that once felt easy. These changes don't automatically mean dementia. Many different factors can affect memory, including poor sleep, depression, anxiety, medication side effects, vitamin deficiencies, thyroid disorders, hearing loss, dehydration, and other treatable medical conditions. That's exactly why early evaluation is so valuable. The sooner changes are discussed, the sooner potential causes can be identified. Brain health, like physical health, benefits from early attention rather than delayed action. Keeping your brain active through reading, learning new skills, social interaction, regular physical activity, and managing cardiovascular risk factors may all contribute to healthy aging. But any significant or worsening memory concerns should always be evaluated by a qualified healthcare professional. Now we've reached the final warning sign. Ironically, it's one of the easiest to overlook because many people simply learn to live with it. Yet it can quietly affect every aspect of daily life. Warning sign #9, shortness of breath during everyday activities. Think back a few years. Could you climb a flight of stairs without stopping? Walk around the neighborhood comfortably? Carry groceries into the house without feeling unusually winded? Now ask yourself honestly, has that changed? Becoming slightly out of breath after vigorous exercise is completely normal, but becoming breathless while performing activities that once felt easy is different. If you're finding yourself needing to stop and catch your breath during routine daily tasks, don't assume it's simply because you're getting older. Shortness of breath may have many possible causes: heart disease, lung conditions, anemia, reduced physical fitness, certain medications, or other medical problems. The symptom itself doesn't reveal the cause, but it tells you that your body is working harder than it should. If shortness of breath develops suddenly, is severe, occurs with chest pain, dizziness, fainting, or difficulty speaking, seek emergency medical care immediately. Otherwise, don't ignore gradual changes either. A conversation with your healthcare provider may help uncover a cause that can be treated or managed. Your breathing supports every cell in your body. When it changes, it's worth finding out why. Final thoughts: your body is incredibly intelligent. Long before many illnesses become obvious, it often begins sending quiet signals, not to frighten you, not to make you anxious, but to encourage you to pay attention. The goal of this video isn't to convince you that every symptom means something serious. Far from it. Many of the warning signs we've discussed can have harmless or easily treatable explanations. The important message is this: don't ignore persistent changes. Don't assume every new symptom is just aging. And don't wait until small concerns become major problems before seeking medical advice. The healthiest people aren't necessarily those who never experience symptoms. They're often the ones who notice changes early, ask questions, and take appropriate action. You know your body better than anyone else. If something feels different and that difference persists, trust yourself enough to have it evaluated. Early awareness doesn't guarantee prevention, but it often creates opportunities. Opportunities to make lifestyle changes. Opportunities to begin treatment sooner if needed. Opportunities to protect your quality of life for years to come. As you finish watching this video, take a few moments to reflect. Have you noticed any of these 9 warning signs recently? If so, don't panic. Instead, let today be the day you begin paying closer attention to your health. Sometimes the smallest signal can lead to the most important conversation you'll ever have with your doctor. If you found this video helpful, consider sharing it with someone you care about. A simple conversation about these warning signs could encourage a friend or family member to seek help earlier than they